Well, welcome everyone to the Coalition to End Social Isolation and Loneliness 2020 Action Forum. We'll be beginning shortly. I'm waiting for others to join. Okay, great. So we're going to get started now. I'm Eddie Garcia. I'm the co-director of the Coalition. I'm going to turn it over to Andrew MacPherson for our opening address.
Thank you so much, Eddie, and good afternoon. My name is Andrew MacPherson, and I'm the founder and co-director of the Coalition to End Social Isolation and Loneliness. I am absolutely thrilled to officially welcome you to the first annual Coalition to End Social Isolation and Loneliness Action Forum. I first want to thank you, our members, our supporters, and attendees for joining us today. We are totally and completely overwhelmed by the outpouring of support and participation in this national event. From Washington, D.C. to states across the country and to nations around the world, we are honored to have you for this critically important discussion. Before we dive into our agenda, I would like to provide some brief background on our coalition, on our work, and our vision for addressing the national and global crisis of social isolation and loneliness. So based in Washington, D.C., our coalition is a nonpartisan, not-for-profit collective of over 30 national stakeholder organizations focused squarely on addressing the growing and substantial challenge of social isolation and loneliness. From health plans to provider organizations, community leaders to consumer groups, Fortune 50 businesses and tech innovators, we convene entities from all corners of the stakeholder community to achieve our shared vision that all Americans have the opportunities and supports necessary to be socially engaged in society. Our goal is to lead a conversation, to catalyze a movement, to promote innovative, evidence-based solutions and public policies to address the crisis in the United States and globally with our international partners who we'll hear from today. As we know, study after study reveals to us the extent of the crisis here in America. Nearly half of Americans report sometimes or always feeling alone or left out. 2 in 5 Americans sometimes or always feel that their relationships are not meaningful and that they are isolated from others. And we know that Generation Z, our young adults in America, are actually the loneliest generation and claim to be in worse health than older Americans. Of course, today we're living in an unprecedented time. While social isolation and loneliness were prevalent prior to COVID-19, efforts to reduce the virus's spread in the form of stay-at-home orders, quarantining, and social distancing have exacerbated an already very serious problem that existed prior to the pandemic. Preliminary surveys suggest that within the first several months of COVID-19, loneliness increased by as much as 20 to 30%, and emotional distress tripled. And that is especially so for minorities and communities of color in America. We also know that older individuals who are socially isolated and or lonely often suffer from co-occurring chronic conditions such as diabetes, chronic heart failure, and depression, leading to greater utilization of potentially avoidable healthcare services. Indeed, studies have shown the Medicare program in America spends as much as $6.7 billion annually as a result of individuals being socially isolated. Clearly, we have a long way to go in this country to address this crisis. But there's hope. I'm hopeful. We collectively are hopeful. Because never before have we seen more collaboration, more innovation, more evidence, more attention, and more commitment to action to help those who are socially isolated and or lonely than we do today. We, the Coalition, believe that this critically important work will fundamentally provide not just a return on investment for our communities, for our healthcare system, for the government, and for the individuals we serve, but will provide a return on humanity. And that commitment is what brings us to our agenda today. So with that, I'll pass the virtual mic back to my friend, colleague, and my Coalition co-director, Eddie Garcia. Eddie?
Thanks so much, Andrew. I agree that this is an incredibly important and exciting dialogue. And we've lined up a stellar set of panels and speakers to match that gravity of the issue at hand. As you all may have seen, today we offer bigger picture perspectives from some of the premier cultural, institutional, scientific, global, and US makers leading on social isolation and loneliness. And tomorrow we'll take a deeper dive into the leading national and community-based organizations delivering services and care across the country that are building greater social connection. So with that, I'd like to jump right in. It's my honor to introduce the next panel, which is our keynote address by New York Times op-ed columnist David Brooks, followed by a short fireside chat with Ellie Hollander, two of the greatest thought leaders and experts on building stronger connection and combating social isolation and loneliness. Again, I have the honor of introducing Ellie Hollander, who is the president and CEO of Meals on Wheels America, the national leadership organization supporting the more than 5,000 community-based programs across the country that are dedicated to addressing senior isolation and hunger. Ellie, thank you for joining us today and for introducing and leading the discussion with Mr. Brooks.
My pleasure, Eddie. Thanks for such a generous introduction, and Andrew, for both of you co-sponsoring this very important action forum. I'm more than delighted, to be here because not only is this topic near and dear to me personally, but also the organization and the network that I represent, not to mention that I am a great fan of David Brooks, and I feel that there is really no one better suited to set the stage for today than he. David is chair of WEAVE, the social fabric project at the Aspen Institute in Washington, D.C. He's a New York Times columnist, a commentator on NPR and PBS Newshour, and author of 5 books, including The Road to Character and The Second Mountain. I'm going to turn it over to David to share his thoughts, and then I'll come back to discuss a few questions during our fireside chat. So with that, David, welcome.
Thank you, Ellie. It's a pleasure to be here. And it's great that this event exists. When you go into newspaper column writing, you don't think you're going to be writing about isolation and loneliness and emotional things. You think you're going to be writing about politics and economics and stuff like that. Washington, D.C. is the most emotionally avoidant city on the face of the earth. And so I was totally cool with that. I was ready to lead a nice, emotionally avoidant life. And yet, as I traveled around the country writing about political polarization, economic dislocation, mass shootings, suicide rates, deaths of despair, everything kept coming back to social isolation and loneliness, and really the tears in our social fabric. And I just wanted to speak briefly about that on 3 different levels. First, on the national level, we all know, I don't have to tell people in this group, the health effects of isolation and loneliness. I just want to make one quick point on the national level. You can be lonely in a crowd. One of the things that alarms me most about the Western world right now, most of it, is the levels of distrust. If you ask people in the United States a generation ago, do you trust the institutions of your society? About a generation ago, people said, yeah, I trust them. About 70 or 80% said yes. Now that's down to about 19%. Worse, if you asked people a generation ago, do you trust the people around you, your neighbors? Most Americans, about 60% of Americans, said, yeah, my neighbors are basically trustworthy. And that's still true in some countries. The Netherlands, 68% trust their neighbors. It's no longer true in the United States and a lot of other countries around the world. 30% of Americans say they trust their neighbors. Most people say they can't trust the people around them. And that's just an existential fear of safety. If you distrust the world around you, you're isolated even when you're near people because you find other people untrustworthy. And the scary part of that statistic is that baby boomers and older people still basically have a fair amount of social trust and trust in each other. The younger you get, the more distrustful you get. So when you get to Gen Z or millennials, only about 19% say the people around them are trustworthy. 71% say most people are selfish. 73% say most people would screw you if they had the chance. Imagine living in a world of that level of unsafety. That's a form of isolation, even if you're around people. And that's a national phenomenon that requires national solutions. The second thing I wanted to talk about is on the community level. I was writing about social isolation and I figured, well, there's a problem being solved at the local level by people I call weavers all around the country. And these are the people working in organizations like Meals on Wheels who are just phenomenal at relationships, phenomenal at connecting people in. Just 2 quick examples. One was a woman I met in Chicago, Aisha Butler, lives in a neighborhood called Englewood, kind of a tough neighborhood. was going to move out because it was dangerous for she and her family. On the day before she was going to move out, she looked across the street at an open lot and saw a little girl in a pink dress playing alone with some broken bottles. And she turned to her husband and said, we're not going to move out. We're not going to be just another family that left this and left these people behind. And so she sent away the moving van. She Googled volunteer in Englewood. One thing led to another, and now she runs RAGE, which is the big community organization in Englewood. It brings people together. It brings people into relationship. And now if you go to Englewood in the stores, they have t-shirts that say proud daughter of Englewood, proud son of Englewood. So they're beginning to create connection where there wasn't. Another organization is called Thread in Baltimore, founded by a woman named Sarah Heminger. Heminger was isolated. Her family was basically sent away and put into exile when, because her parents had exposed some embezzlement at their church. And so she had an extremely lonely childhood. She went to Johns Hopkins, was getting a PhD in neuroscience. And she was on a bus driving by a high school in Baltimore. And she looked out the window and saw some kids looking extremely lonely outside the school. And she looked out the window and she said, I know exactly how they feel. And so she created an organization called Thread that surrounds hundreds and hundreds of underperforming Baltimore students with 4 volunteers who basically drive the kids to school, give them lunch, serve an extended family. Then there's another circle of another 4 people called grandparents. Then there's 12 more collaborators. Basically, you're creating an elaborate social network around these kids. And so she's creating connection where there was none. And she's just phenomenal at creating cultures of connection. And the 4 basic themes of Thread or organizations are: 1, show all the way up. When you're in a meeting, be fully vulnerable and fully present to people in that meeting. 2, learn from all voices. All problems are so complicated. We need to have all voices at the table heard from. 3, treat relationships as wealth. They're the assets of your organization. And 4, fail forward. Your organization, you're going to fail constantly. And at Thread in Baltimore, they know how to fail forward. And that's something they do together. And so it's a deeply relational organization. And that brings me to just the final point I want to make. I've talked a little about national, a little about community organizations, neighborhood by neighborhood. But essentially, the end of loneliness has to be personal. Emerson once said, souls aren't saved in bundles, they're saved one by one. And loneliness ends when we make a personal connection with somebody else. And I've spent a lot of time thinking about that skill. And I've come to think that the key to every healthy family, classroom, organization, nation, or society is the ability to see someone else deeply and be deeply seen. And somehow we're lacking in that skill. In my reporting, basically what I see is an epidemic of blindness in society. Black people feeling their daily experience is not understood by whites, people looking across the partisan divide at each other in blind incomprehension, rural people not feeling seen by coastal elites, kids in the basement, adolescents who feel that nobody knows them, husband and wives realizing the person who should know them best doesn't see them at all. And so I've spent a lot of time thinking about what is that skill? And, you know, I had an experience, my wife was standing at the front door of our house. This was about 6 months ago. And she was standing by, and the door was open. She was standing looking at an orchid, which was next to the front door. And I looked up from some boring book I was reading, and I looked at her, and the light was coming in behind her. And I had the sensation, I really know her. I really know her well. I'm sure you can have this sensation with your spouse or your kids. Just a sense, yeah, I really know that person through and through. And when you know somebody that well and you can make them felt that way, it's not the facts about their lives, it's not the adjectives. It's something about their flowing, it's something about their subjectivity, their consciousness. You know how they respond to the world. You can almost see out through their eyes so you know how they see you. And getting that kind of knowing is something we don't teach in school. We don't really know in society, but it's so important. Just 2 final examples. I have a friend whose daughter was in 2nd grade and she was struggling. And one day in the middle of the year, the teacher said to her, you know, you're really good at thinking before you speak. And that one little comment turned the girl's year around because suddenly she felt known and understood. Something that she thought was a bad thing, her social awkwardness, was actually a good thing. It was thoughtfulness. And so she was known. and loneliness ended for her that day. Now, the final thing, sometimes being known is not the most pleasant thing, but it's always the most useful thing. If you guys remember that movie, Good Will Hunting, Robin Williams plays a therapist and Matt Damon plays this math whiz. And for the first part of the movie, Good Will Hunting, played by Damon, is like going from victory to victory. He's effortlessly solving math problems. He's got verbal wizardry. He's great at stereotyping people and putting them down. And he does this to the therapist played by Robin Williams. And then if you remember, there's a scene on a park, on a bench. And Williams says, you know, you really hurt me the way you stereotyped me. But I realized you don't know anything. You're just a scared kid. And I don't see a courageous, self-confident man. I see somebody who's afraid to talk about himself because he doesn't know what he's going to say. And the speech goes on. It's a very beautiful speech. It's on YouTube. And Robin Williams says, if you want to talk to me, I'm all in. But if you don't, I'm gone. It's your move. And if you remember that scene, you know how painful it can be to sometimes be seen. But that's a moment when you acknowledge the truth of what has been said about you and you feel weirdly honoring. And so these are just opening comments that on a national level, we have a problem, on a community level, we have a problem, on a personal level, we have a problem. But all three are solved by just developing the skills of seeing each other, of building organizations that see each other, and then mobilizing the resources of government to create those kind of organizations. Thanks a lot.
Thanks, David. Sorry, I was thinking before speaking. I was listening intently to what you had to say. And I want to say, with tongue in cheek, I see you. But I understand exactly what you mean, which is, you know, to unpack everything that you said in such a short amount of time is incredible. But to see someone deeply and to be deeply seen is a great attribute to strive for. And I'm going to really think about that a lot tonight. I think you've stimulated our thinking on this timely and critical topic of social isolation and loneliness. And it's an issue that for decades has been core to what Meals on Wheels is all about, as you mentioned earlier, ensuring that the seniors that we serve are nourished both physically and mentally and through good nutrition and socialization. We always say that Meals on Wheels is more than a meal, that the meal is the entree, if you will, to opening the door to companionship. And it's also equally important as nutrition is. But you have to have the trust, as you mentioned earlier, to be able to be invited into someone's home, to be able to engage. Meals on Wheels, we've been working to enable local programs to augment their in-person daily visits with additional opportunities for social engagement, including friendly visitor and telephone check-in programs, pet assistance programs, and more recently, tech-based interventions. But nothing replaces the power of social connection, of human-to-human connection. And the need has never been more apparent than now amid a global pandemic in which millions more across all age groups are now experiencing social isolation. You know, previously more hidden, a silent epidemic really. I'm glad to see it being exposed, to be brought to the fore so that it can be addressed head on. And I'm really pleased that we're part of this multi-sector effort to seek and to put into action solutions to scale to the magnitude of this issue. So David, segueing to our fireside chat without the fire, you know, there are a number of individuals and organizations listening in today who may be on different paths and different places in that continuum of that journey. But for those who are beginning to embark in this area to address social isolation and loneliness, do you have any advice or recommendations on where to start or how to begin?
Yeah, some of it is just creating a good technology of convening. And you guys do it through food. And that's a common table. You put a table, people eat around food, and that's a technology of convening. There's a group called Becoming a Man in Chicago. And they take young men who are gang members, and they have what they call a check-in, where they meet once a week, and they go around the table, 12 guys, and how are you doing intellectually, emotionally, spiritually, and physically. And these are gang members who are heavily armored up. And so to be able to unveil themselves in front of members of other gangs is an unprecedented activity. And so they've created a technology of convening. The final one I'll mention is called Roots of Empathy. And what they do is they take young kids, eighth graders, and they try to teach them empathy. And the way they do it is they take a mom and an infant and bring them into an eighth grade classroom. And they have the eighth graders sit around and the baby's crawling around, grabbing for things. And they have to guess what's going on in the baby's mind. That way they learn to what's going on in somebody else's mind. And the most beautiful story from Roots of Empathy was one day there was a kid named Darren who had been held back a couple of years. He'd been through the foster care system. His mom had died. And he was bigger than all the other kids because he was just older. And he asked the mom, "Can I hold your baby?" And the mom was nervous because Darren looked scary. But she gave Darren the baby and he held the baby and he was fantastic with the baby. And he handed it back and he asked a bunch of questions about parenting. And finally he said, "Do you think you can be a good dad if you've never been loved?" And so what Roots of Empathy does is they take kids who are just isolated, have never been in that circumstance, and they give them those kinds of emotional skills. So being able to talk about emotion is something like a middle-aged white guy I'm not comfortable with, but crossing into that ground is just super important. And it's what people are hungering for.
Those stories are amazing. And, thank you for sharing them. I'm wondering about, there's so many people that may be suffering in silence that, are often forgotten. They're not visible to most of society. They may not see an opportunity to go to one of these sessions. Any suggestions on, how to reach out, how to connect with those individuals who may be, behind closed doors?
Yeah, a lot of it is shifting your norms about how you think it is to be a neighbor. Like we ran into a woman in Florida, and she was helping kids across the street coming out from elementary school. This was pre-COVID. And we asked, "Do you have time to volunteer in your neighborhood?" And she said, "No, I have no time." And we said, "Well, you're getting paid to do this?" And she said, "No." And then we said, "What do you do in the rest of the day?" "Well, on Thursdays, I go to the hospital to bring food to the sick." And then we said, "Do you have time to volunteer?" She said, "No, I have no time." And so for her, that's not volunteering. That's just what being a neighbor is. And just even inviting your neighbors out to your apartment or whatever is part of, it's a shifting of a norm. And I grew up in New York City, we have a norm where you don't talk to people because there's so many of us. But if you shift your norms, you can really have a dramatic effect on society. So that's the first thing. The second thing what we try to do is lift up people like yourself, frankly, people who are really trying to create connection. And the people we lift up, they never talk about, I'm not doing things for people, I'm doing things with people. Sense of radical mutuality, radical hospitality. And they are the greatest people to be around. They're just, they're joyful. But what we've learned is you have to help the people who are in the neighborhoods. The people who live in the neighborhoods where they work are the ones who are trusted. And they're the ones who know what to do. But often at the neighborhood level, they don't have access to the foundations and the resources. So what we've done is we have some access to foundations and resources. We're good at finding the people at the neighborhood level who are trusted and who know who's lonely down the street. And so we've got to transfer resources from the national level to neighborhood by neighborhood by neighborhood to the trusted people who already live there.
Yeah, it's interesting. We talk at Meals on Wheels, it's, helping one person at a time. It's finding those individuals and then the multiplier effect, if you will. It's great. Right now with the pandemic, one of the things that we're focused on is don't stop now. Don't stop checking in on someone that you haven't spoken to. Don't stop seeing if your neighbor's okay. So I think what you're doing is you're talking about taking that to scale, which is really important. Now, shifting a little bit from these stories to the fact that we're in a current environment of racial injustice, the COVID epidemic or pandemic on top of that. What are your thoughts, David, on what perhaps new actions and or policies at the national level are needed to address social isolation and loneliness going forward? Are there any silver bullets out there, anything that you've been thinking about? If we could just do this, I think this would be a great lever to pull.
Yeah, well, first we should acknowledge we're trying to do something really hard. We're trying to build the world's first multicultural, hyper-pluralistic democracy. And in a few years, we'll have no majority group. We'll all be different minority groups. And so we're trying to do something hard. And that's why I think the skill of seeing others across difference suddenly becomes so important. You can't survive as... I don't think government can create relationships, but I think government can create platforms on which relationships can be built. And so, for example, I think a national service program that asked young people to give a year of service for 2 years of free college would get somebody from Mobile in the same room as somebody from Massachusetts. And that by itself would be a win. But then getting them in the habit of serving and making these social connections. I also think it's possible to create that. So many, as I said, the neighborhood is the unit of change. But government can create endowments where local civic leaders shift resources to people who are in the neighborhoods. And you can have sort of a Peace Corps for people already in the neighborhoods doing that kind of civic work. We can also turn schools into community hubs. Right now, schools are often much more isolated within the community and not really hubs of community. And so there's a whole series of ways government can come in, hospitals and healthcare. Government can come in and create the platform on which relationships are naturally going to form.
Great. You know, I get asked this question by the media sometimes, and you probably do too, but since we're almost at the end of our time together, which I've really enjoyed this conversation, is there anything that we didn't get a chance to cover that you'd like to impart some wisdom onto the listeners here today? I've
used up all my wisdom now. I would say, you know, I do think we do have to grapple with social media. I mean, in every form of what I think a lot of young people especially are challenged with is there's understanding nowhere but judgment everywhere. And so there's a sense that I'm constantly being judged, and how we see ourselves is how others see us, especially when we're young. And so a sense of how do we get control of that? And I have a friend, before he wakes up in the morning, or before he looks at a screen in the morning, he goes outside and looks at the sky. He's going to get his priorities right. And he has a social media Sabbath, an hour a day a week, month a year, no screens. And so instituting within our own families those kinds of rules is how we get the advantages of the technology without some of the downsides.
I couldn't agree with you more. I think back to your earlier conversation about trust and building trust, and the fact that, as you said, the younger you are, the less trust that you have. I can't help feeling that because technology has been so embraced in lieu of those interpersonal connections, that has really, trust has suffered as a result of that. And just sort of getting back to that, nothing replaces, in my view, that person-to-person contact, which is why this pandemic is so challenging. What we've been trying to do at Meals on Wheels is emphasize the fact that we can be physically distant, but we need to be socially connected. And so with that, I think I'm going to wrap it up and say, David, thank you so much on behalf of all of us for being here. I know how busy you are because I've tried to connect with you many times, and we're just delighted to have you here today. It's a real honor for all of us. And also, I just want to say that you've left me with a lot of food for thought, no pun intended, coming from Meals on Wheels, but a lot to think about and for all of us to think about. So now what I'd like to do is turn it back to Eddie to introduce the next panel. And David, thank you again. Really appreciate the connection.
Thank you. Thanks for what you do.
Right. Wow. Honestly, what an emotionally moving discussion for me. I was texting my colleagues that I actually teared up for a second. It just really got to me. And that's how important and powerful this discussion is and will be throughout the next 2 days. You know, for hearing from two foundational leaders in this space is such an honor. So sincerely, thank you, David, and thank you, Ellie. We're excited to be partnering with you and to be working on this together. I was really interested in their thinking on how we create the greatest impact by making it personal, together, truly seeing each other and showing up for action. And our next session really supports just that, how we marry the greatest evidence with real-world application. We will be now moving into our next panel, which is our Scientific Advisory Council panel, who will dive into their reasoning for coming together, their individual research and expertise, and where we might see the greatest impact for their work moving forward. Our moderator is Dr. Julianne Holt-Lunstead, who I'm sure you all know well. Dr. Holt-Lunstead's research is focused on long-term health effects of social connection. Her work has been seminal in the recognition of social isolation and loneliness as risk factors for early mortality. She has worked with government organizations aimed at addressing this issue and provided expert testimony in US congressional hearings and provided expert recommendations for the US Surgeon General's Emotional Wellbeing in America initiative, and is currently a member of the technical working group for the UK cross-departmental loneliness team. She's also serves as a scientific advisor for the Australian Coalition to End Loneliness, who we are closely affiliated with, and the Foundation for Art and Healing, and research advisory panel for AARP Services, Inc., United Healthcare, and Rural Aging. She has been awarded the Citation Award for Excellence in Research by the Society of Behavioral Medicine, the George A. Miller Award from the American Psychological Association, and many, many more. Of greatest privilege to me, she's also the inaugural chair of our Scientific Advisory Council and someone who I call a friend, who you'll meet now. So thank you, Julianne, and thank you for leading this discussion.
Thank you, Eddie. That was really a kind and generous introduction. Thank you so much for inviting me to be a part of the Action Forum and for the opportunity to moderate this session. It is certainly a great pleasure and honor to be here with you and the rest of the audience here today virtually. As Eddie mentioned, I have spent my entire career, spanning nearly 2 decades now, studying the health implications of being socially connected, or conversely, the risk associated with social isolation and loneliness. My work has taken an interdisciplinary approach to this topic. So just to give you a little bit of background about me, so that my work has examined the overall associations with morbidity and mortality, also taking a multi-method approach to examining some of the biological mechanisms that might explain some of these associations, as well as an examination of relationship factors, such as relationship quality that may significantly influence the direction of the effect. In other words, our relationships can be incredibly powerful effects on our health for either good or bad. More recently, my work has begun to focus on the public health relevance of social connections, and in particular, a focus on measurement, interventions, and policy, all of which are sorely needed to reduce risk. During my career, I have also witnessed this topic going from being virtually ignored outside of academia to the appointment of a minister for loneliness in the UK, and as well as the publication of a national strategy in the UK. I served on the committee that helped to establish a national measurement of loneliness in the UK for their Office of National Statistics. Now, the US has also made some important strides, including the recent National Academy of Science report and recommendations on social isolation and loneliness in older adults, as well as the formation of the Coalition to End Social Isolation and Loneliness and its work to seek needed federal policy changes. But we still have a long way to go. What has been missing from the academic and private sector research communities has been a standing body dedicated to translating the evidence into real-world application, cohesive assessment gaps in the research and evidence, and creating a forum for scientific collaboration. That is why we came together to form the Scientific Advisory Council, hosted by the Coalition to End Social Isolation and Loneliness and operated by the Foundation for Social Connection. So before we begin our panel discussion, I would like to first provide an overview of the Scientific Advisory Council. The Scientific Advisory Council acts as an independent advisory council to both the Coalition to End Social Isolation and Loneliness and the Foundation for Social Connection, and provides consensus recommendations on matters of scientific research and evidence that relate to national and local policy, research, and program implementation and development. The primary objectives and responsibilities for the Scientific Advisory Council include, first, to assess relevant research tools and/or active interventions based on evidence, developing in the field and share with the coalition. Second, provide scientific advisory to organizational level initiatives and policy priorities. And third, to highlight areas of need and/or opportunity for future research and interventions that the organization should promote. The membership and organizational structure includes the following. So membership and participation within the Scientific Advisory Council is completely voluntary, and members are not required or prohibited from advising on any topic, policy, or initiative. In terms of its size, we wanted to keep the committee manageable. So it will consist of 10 to 15 members. However, additional members may be added on an ad hoc basis. In terms of considerations for membership, our aim was to establish a council of individuals representing a wide range of views and perspective, including both academic and field experts. Thus, in considering any individual for membership on the Scientific Advisory Council, each member should bring expertise in social isolation and loneliness as it relates to age, gender, sexual orientation, geography, socioeconomic status, among others. Our goal is to include experts from diverse backgrounds focused on social isolation and loneliness, but including backgrounds in medicine, spanning from pediatrics to geriatrics, social epidemiology, psychology and psychiatry, economics, public health, anthropology, biomedical sciences, statistics, and technology. The leadership of the Scientific Advisory Council will consist of a council chair and a vice chair. And in terms of the reporting structure, the Scientific Advisory Council will report and provide advice to the executive committee of the coalition. I am honored to be serving as the chair of the Scientific Advisory Council, and it is with great pleasure that I would like to introduce to you a few of the members of this council. Thus far, we have an impressive group of experts from diverse academic backgrounds. Nonetheless, with an eye to diversity and representation, we recognize that there are a few gaps that we aim to fill. Not all of our council members could join us today, but we are fortunate to have 5 of them with us, and I would like to introduce them now. Before we begin our discussion, I want to give each one of these members a couple of minutes to introduce themselves in more detail, sharing their area of expertise, what they bring to the Scientific Advisory Council, what they have chosen to focus on in terms of social isolation and loneliness in their career, and a little bit of background on their program of research, what they're working on now involving social isolation and loneliness. So I would like to introduce our first panelist, Juan Albertorio Diaz, statistician from the National Center for Health Statistics and the Center for Disease Control. Juan, I invite you to turn on your camera so you can introduce yourself a bit more in detail.
Thank you, Julianne. Good afternoon, everybody. My name is Juan Albertorio. As Julia mentioned, I'm a statistician for the National Center for Health Statistics. Currently, I'm part of this group, and also I'm the co-chair for the Social Isolation Loneliness Working Group at Center for Disease Control. The aim of this group is mainly to establish a dialogue, a collaboration, and to foster an exchange of work regardless of social isolation and loneliness as a threat to public health. Currently, I'm working in several areas on the direction of Julian Holtlands, that in where we try to see how we can establish an exchange with other countries, as well to development of several works. One we have on the wraps is the development of the utilization for the development on the International Classification for Functional Disability to establish a classification for loneliness and social disconnectedness. Nothing more to add, so I will leave that time to the rest of the group. Thank you.
Thank you, Juan, and we're very grateful to have you on not only the Scientific Advisory Council, but on this panel here today. So the next panelist I'd like to introduce is Dr. Matthew Pantal, Assistant Professor of Pediatrics in the School of Medicine at the University of California, San Francisco. Welcome, Matt, and if you haven't already, please turn on your camera and turn it over to you to introduce yourself.
Thanks, Julianne. Hi, everyone. As Juliette said, I'm an assistant professor in pediatrics at University of California, San Francisco. While clinically I work as a pediatrician and hospitalist, my research is centered in the Center for Health and Community and then the Social Interventions Research and Evaluation Network, which investigates strategies and interventions to integrate social and medical care through evaluating interventions. And my research broadly focuses on using large databases to investigate the relationships between social determinants of health and health outcomes, as well as social informatics, which is essentially using EHRs to capture and apply social data in conjunction with health data to improve clinical care and advance individual and population health. And then finally, I work on addressing social needs and social determinants specifically in clinical settings. I've chosen to focus on social isolation and loneliness throughout my career because I've always been interested in its undeniable strong association with health outcomes, and also the fact that it's a topic that allows for creative thinking about solutions. In the past, I've used large databases to investigate its relationship, the relationship between social isolation, loneliness, and health outcomes. And then currently I'm looking at the landscape of screening for social isolation in clinical settings, as well as talking to international stakeholders involved in implementing isolation and loneliness interventions to identify lessons learned to inform future interventions here in the US. And I think, what I bring to the committee is sort of the experience of incorporating and evaluating social interventions in clinical settings and sort of within health systems. And it's a pleasure to be here.
Welcome. We are grateful to have you here. I would like to introduce our next panelist, Dr. Kelly Harding, Assistant Professor of Clinical Psychiatry at Columbia University Medical Center. Kelly, I invite you to turn your camera on, and we would love to have you share a bit more about your background.
Well, first of all, hi, everybody. This is such a pleasure to be here, and it warms my heart to know that these conversations are going on. So my background is I, long ago, back in medical school, got very interested in this question, what are we missing in medicine? Because I very early noticed that there was this disparity between what we were expecting in terms of diseases and then the outcomes. And I spent much of my early career in pursuit of this question, and I studied first internal medicine and then psychiatry, and I still didn't feel like I had the answer. And clinically, I've spent my time working as an emergency psychiatrist in the emergency room in a busy New York City hospital. And I realized that a large part of what we were missing was our social environment and loneliness. And in fact, as many of you on the call know, it attributes so much of our health outcomes are related to this. And we're obviously seeing this with COVID right now. But it was this that really made me realize we have to get this message thinking about our social impact, the social world's impact on our health, far outside clinics and public health and into our communities and to what David Brooks called all the weavers that are out there. So I wrote a book recently called The Rabbit Effect, where I tried to explain this idea and weave together all the incredible research, many of which has been done by members of this committee, so that we can get awareness out there and address this problem meaningfully. So thank you for all that you're doing.
Thank you, Kelly. We're very grateful to have you as part of our council. I'd like to next introduce Dr. Louise Hockley, Senior Research Scientist at NORC at the University of Chicago. Louise, tell us more about your background.
Hi, Julianne and fellow panelists. It's a joy to be part of this group. Yes, I've had a long career devoted to the study of loneliness going back to the 1990s. I'm a research scientist at NORC at the University of Chicago at present, NORC, which I often fondly refer to as formerly known as the National Opinion Research Center. But as a senior research scientist there, I'm also a co-investigator on the National Social Life, Health, and Aging Project, which is a longitudinal study of over 4,000 older adults, community dwelling older adults in the US, and we're tracking them over time to see how their social relationships and all aspects of their social life, including their degree of loneliness or their felt isolation, is affecting their health and vice versa. My study of loneliness has really spanned the whole gamut from defining what it is and the forms it takes, how it's different than social isolation, helping to develop a theory about why this aversive state even exists, how people differ and why they differ in their susceptibility to loneliness and the degree and duration of their feelings of loneliness, and then why loneliness matters. And people have already, a number of you have already alluded to this well-known literature now that connects loneliness to physical, mental, cognitive, and emotional health and well-being outcomes. And I've also included in that, in this interdisciplinary work, work with molecular biologists looking at how loneliness affects physiological systems, cells, molecules, genes, and then looking also at interventions. If all of these things are true, then what can we do to alleviate loneliness? And will those effects on loneliness translate into improvements in health? And we did a meta-analysis where we studied a bunch of published interventions from 1970 to 2009, and essentially summarized that we've got a long way to go, that there are very few well-informed interventions and effective interventions. I continue to research loneliness. My work now is increasingly turned to real-life solutions. So at the moment, I'm working with the Illinois Aging Services Network, which is a nonprofit network of organizations in the field of aging services, and the Illinois Association of Area Agencies on Aging. There's a lot of acronyms, gets into this field, to evaluate programs that the state area agencies on aging have deployed before and since COVID, to see how effective they are and what needs to be done to learn more about helping people in the field deliver effective programs. And that's it. Thank you.
Thanks, Louise. I am so happy to have you on our panel. I'd like to, last but not least, introduce you to our final panelist, Dr. Matthew Smith, who is the co-director of the Texas A&M Center for Population Health and Aging and associate professor at Texas A&M School of Public Health. Matthew, I'll turn it over to you to give a little bit more background on you.
Wonderful, and thank you so very much. I am an evaluator, an interventionist, and survey methodologist by training, who primarily focuses on older adult health. And I really take an applied and translational research approach to identify those practical solutions that can really influence health, try to help identify the effectiveness of those interventions, and really put them into the hands of the people and the settings organizations that can use them most. I really focus on bridging the healthcare sector, aging services network, public health system to create those solutions that can be translated and adopted across all of those different settings and really help everybody synergize and leverage their efforts. A lot of my implementation and dissemination efforts around evidence-based programs and innovations are really striving to identify the networks, the most appropriate entry points, leverage points, so that people can work together. I'm relatively newer to the social isolation and loneliness field. I've actually been working and more interested in it based on the inherent problems and issues that is posed by these conditions, primarily because even though the issues are very widespread, the people who are most impacted are oftentimes invisible. They go unrecognized by their providers, social networks, and everyone, if they even have those networks. So the stigma and everything surrounding social isolation, loneliness, really makes these individuals especially vulnerable and needing of interventions and assistance. And so with that, in my own work, as an evaluator, as an interventionist, as a methodologist, I've been developing tools that can help to detect social isolation and loneliness and overall connectivity risk across settings. Over the last 2 years, we've been working to develop the upstream social isolation risk screener and embedded in various systems nationwide. But also I've been evaluating existing interventions to document their intended and unintended effects on social isolation and loneliness. So much of what we do is not created for social isolation and loneliness impact, but it can influence them. So that's a lot of what I've been doing. Thank you very much.
Thank you so much. And thank you all of the panelists for sharing with us your backgrounds. I'm sure everyone is as impressed as I am with this, but this gives our audience more familiarity with your unique perspectives that you can bring to the Scientific Advisory Council. And so now I'd like to start the fun part of our panel where we get to have a discussion. And so I want to start really by acknowledging the fact that social isolation and loneliness are incredibly complex. And so clearly, we all need to work together in order to find effective solutions. And this is going to be incredibly challenging. So my first question to the panel is, what do you see as the biggest contribution that the Scientific Advisory Council can bring to partner organizations, and as well as how do you think that partner organizations can best support the Scientific Advisory Council? Now, this question I'm posing to the entire panelists, but I'm hoping that Matthew Smith can lead us out, and then anyone can jump in and add to his remarks.
Certainly. Well, as one of the contributions of the Advisory Council to partner organizations, I would say is sharing findings, whether they be our own or whether they be from others in the field. And I know with Juan and all of the efforts that the CDC is doing in his role, that is a really outstanding resource. But one of the things that we can do is also take that research and help to translate it, make recommendations, and try to make it more digestible and applied and actionable for different settings and organizations. I think one of the other things that we can do is, of course, diversify the communication channels. Sometimes as academics, we have certain channels. Sometimes as practitioners, we have certain channels. And sometimes as industry fields, we have different channels of getting the word out. The same message can actually be delivered in multiple different ways. And what I think that we can do is help to identify those messages and make sure that everybody hears them in their most appropriate platforms. one of the things that I think that the advisory board can do to us, or for us, or to, is of course serve as a sounding board. So much of the work that we do, it's great to understand the real world use cases and the applicability of what we're doing. How does it live? How does it need to adjust? I'll stop there and let others can chime in as well.
Well, I can just reiterate the value of compiling information from diverse sources. I was thinking that if we could, I would like to be party to creating essentially a national repository. There's so many standalone efforts that are popping up all across the country, and we don't know about each other's work, and we're reinventing the wheel here, there, and everywhere. If we had a way of consolidating that information together with whatever evidence base comes with it, that would certainly be useful. And I think it could lend itself well to distributing it to via these different channels that Matthew was talking about, whether it's academics or practitioners or policy people and so on.
And I'll just add to that, that actually was one of the recommendations in the recent National Academy of Science report that was published just February 27th of this year, actually recommending a national resource just like you describe. And so that is absolutely something that I think is so needed right now, and so hopefully we can work on getting that funded, right? Kelly, it looks like you'd like to jump in.
Well, I was just going to say, just to build on what the rest of the group has said, that, you know, I mean, loneliness and social isolation is something that affects every single human being throughout their lifespan, and I think or it will affect them during their lifespan. And I think what's so lovely is there's an opportunity to come together in so many respects. And there is, exactly as Matt said, there's so much research that needs to be translated. And that's not just for the people that the organizations serve, but also for the organizations themselves. And I think we're seeing this within my own profession of medicine is, you know, how can we take some of these skills and best practices and also apply it to strengthen our own practice, and think about how we can build communities, you know, in places where we maybe didn't see them before. So I think there's so many opportunities, and it's going to take every single person who's on this call and every single person who's in their organizations to look for those changes and look for the opportunity to apply the research. I'm excited. So.
And I love your call to action. Everyone on this call. So earlier, Matthew had mentioned an effort, Juan, that you've been doing with your listserv. Can you take just a second to describe what that has involved?
I'm sorry, can you repeat the question, please?
So Matthew had mentioned the listserv that you have begun. Would you like to just take a minute to just mention what exactly that entails?
Sure, yes. Thank you for the opportunity. Well, folks, I've been working on this topic, I would say, like 2.5 years. And since the beginning, I started realizing that there was no body or organization per se at HHS level that was addressing social isolation and loneliness. So I tried to discuss this with other colleagues and you know, start to foment that discussion. Say, well, how we can start serving this community, at least within CDC, and then moving out to extend the communication. So the thing is, we start making a listserv in like a weekly basis. We start to sharing the most recent peer review activities and collaborations that I can find. I'm a little bit a warm book, so I'm able to do systematic research, and was easy to do it. So it seemed that this S4 started adding more and more attention. As a matter of fact, we started like 4 or 5 people, and now we have like 106 participants from around the world. We have 4 from United Kingdom, Australia, Indonesia, I mean, you name it. And I think that then this had been a need to have that kind of listserv and create a foster collaboration environment to all. That I would like to continue doing it in official matter, which means that the group that I started at CDC, we try to officialize that as a group for obviously for CDC, and try to look for some fund to do another research and another collaborations in terms of the threat of public health as a the socialization as a threat to public health, and to continue to making the call not only for institutions as HHS, but other institutions as well. Recently, I realized the American Community Living, ACL, have a lot of interest in this topic. And we start to see how we can create a good communication with them to see either they take the initiative to have a better and more manageable group, or to have the LIVSER, or to have that social collaboration between the government, non-profit organization, and other parties as well. So at least right now, this is the direction that I'd like to continue the collaboration. What will be the aim? Obviously, to spark the discussion and see how many brains we can put together and try to help with each other. I hope that answers your question, but anything else?
No, so, you know, this has been, Juan shares, you know, the latest publications that have come off the press. And this really helps to bring together scientists from a variety of disciplines that are focused on social isolation and loneliness. And I think it really aligns with our goals here as the Scientific Advisory Council to share information, and then how that information can then be shared with our partners. And so just to follow up with the kind of the second part of the question I asked previously, you know, how do you think partner organizations can best support the Scientific Advisory Council? We're going to have some challenges. So I'd like to pose to the panel, you know, what do you see as some of the biggest challenges for our Scientific Advisory Council? And I'm going to ask Kelly or Dr. Harving to lead off on this discussion.
Well, thank you. I was going to say, and this is such a meaningful discussion because I think, you know, there are a lot of opportunities and a lot of challenges. And I know one challenge that we're all facing is, you know, there's a lot of pain out there right now, and we see that manifest in different ways. And loneliness is certainly, you know, sometimes anger, loneliness all go bundled together, as we know from the research. I think the other thing to know is with COVID, you know, we've seen a threefold increase in mental health and depressive symptom diagnoses. And I think the other piece of that is, you know, we don't have enough mental health professionals to go around. So I think a big charge of organizations, including the coalition, is to think about how we can empower people to support one another and how to use best practices to do that. You know, the statistics are so troubling. I think, you know, we saw in June that 1 in 10 Americans contemplated suicide. So this is of a magnitude we've never seen before. So I'm grateful for the work that's happening. It's not going to be easy. There'll be mistakes, but I think that at the same time, we've got to keep moving forward. And just even having this discussion is such a step in the right direction. So thank you.
Thank you.
And, you know, to add to what Kelly was saying, and actually to add to what everybody was speaking about before, I think one of the challenges is that contribution that we're going to be trying to make is, you know, there are a lot of people doing this work in sort of silos. And so, you know, I think part of the solution is trying to create more centralization of this. And I think in doing so, that will hopefully snowball, you know, as we try to do that more and more, I think our, you know, reaches will go further and further. And we see those people that, you know, a lot of people are doing this work, but it's not published in peer-reviewed journals that are sort of more accessible to academia, and you know, trying to find out those practices that are doing the work and trying to pull from them learnings that we can apply more broadly, even though we might not have the specific resources of this city or of this town or of this, you know, healthcare institution. What did they do and learn from doing it that we can then apply to more broadly using, you know, local resources there. So I think, you know, part of the challenge will be part of what we're seeking to create with this sort of centralization, and hopefully it will sort of have this snowball effect.
Yeah, that is my hope as well. It looks like Matthew, did you have something to add?
Yeah, thank you so much. I also realize that my camera's over here, but I'm seeing you all over here. So one of the things that I also would say is that time is one of the biggest challenges. We all know that it actually takes time for research and innovation to diffuse so that it influences practice and policy. And so while we're really looking to identify relationships and solutions in the most rigorous way, the situation and context can change. And especially with COVID and uncertain times, we see this now. So what we once knew before COVID maybe isn't as applicable or possible currently. And also, we just need to think about what we develop as being structured and rigorous, yet flexible, so that we can also be very pragmatic in our implementation. Time changes a lot of things in good and bad ways.
Absolutely. I see some thumbs up. I think we're all in agreement on that. Certainly time is a huge challenge. And, as Louise was talking earlier about having a central resource, funding and resources to do that are also incredibly challenging. We're in a time where resources are scarce, and we need to be incredibly mindful about using resources most effectively, but can also limit the kinds of things that we're able to do also. And so that's something that we'll certainly need to keep an eye on. Many of your comments really, I think, tied into the fact and nicely transitioned into the fact that we are currently facing a global pandemic. And as if addressing social isolation and loneliness wasn't challenging enough, we now have unique challenges. We're now in a time where, the thing that we crave the most, human contact, we're being told we need to limit. And so this is incredibly challenging. So I'd like to pose to our panelists, based on your own research and expertise, what do you think are the key questions that we, and when I say we, I mean not only the Scientific Advisory Council, but the scientific community and partner organizations, what should we be asking right now? Or what approaches should we be evaluating? And so I'm going to ask Matthew Pantal or Matt to lead us off on that. This next question.
Great question. Thanks for asking it. Yeah, I think, as you mentioned, COVID has brought, huge amount of loneliness and social isolation that might not have been there before, and exacerbated it where it was there. And I think, with that, it's brought a massive recognition of social isolation and loneliness as problems, and how effective they can be in terms of affecting your daily life and craving social support and connection. So I think with all of that recognition has brought out some things that I think will be interesting for the committee to ask and evaluate about, which including how did organizations that weren't addressing social isolation or loneliness before, how did they do this during the pandemic? A lot of organizations actually took up addressing isolation and loneliness as sort of causes, because they saw how much it was affecting whatever industry they were working in, whether it was in schools or whether it was in healthcare. But we noticed, I know, speaking from the healthcare perspective, I've tried to advocate for talking about social isolation and loneliness in clinics for many years, and sometimes it felt like I was talking to a wall. And now people are really getting it and realizing how important it is to health. So I think there's a lot to learn about how organizations adapted to this recognition of how important an issue social isolation and loneliness are, and figuring out with these resources that we had or lacked during the pandemic, what organizations did to now adapt to sort of addressing social isolation and loneliness. And I think another thing we can learn from is how those organizations that already saw this as an issue and were addressing social isolation or loneliness through interventions before, how did they have to adapt? Some of these programs, a lot of them focused on in-person interactions or community organizations that relied on a lot of face-to-face interactions. Not all of them, but some of them did, and a lot of them have made some really creative changes that would be really great to learn from and provide as blueprints for people trying to do this type of work in their own communities. So I think there's a lot to learn with how people adapted during the pandemic and to disseminate those findings.
Yeah, I think the key there is we all have a lot to learn, right? Others, what do you see as some of the key questions that we should be asking or approaches we should be evaluating?
This is one, and I think that, before the conversation go beyond, one thing that we probably can do as a group is provide a consistent message of what we mean by social isolation and loneliness, and see how message is shared with others, and also the people who disagree with that. Because as you may know, there is several ways, several dimensions, several aspects of social isolation and loneliness that we know we are not aware of. And I think that if we start to limit them, as a limit that instead of the scope of the idea, what to try to do can help us to focus more in several areas that can be feasible to work on.
Yeah. So certainly, as you point out, social isolation and loneliness are distinct concepts, and Louise certainly brought that up earlier. And so part of understanding this current situation is keeping those distinctions in mind, as well as the different ways in which both social isolation and loneliness have been measured and conceptualized. And that there's complexity even in that. Kelly, did you have, oh, sorry, Matt, or Matthew.
Yes, well, I would love to build upon that, because what I see as one of the really interesting questions to be asked is, because of the interrelated nature of social isolation, loneliness, depression, and all of these other issues, how can we best identify the situation actually being experienced by the individual so that we can actually provide to them the most impactful resources, services, programs, so that then we can identify. I know that some of the interventions might be able to influence all of these things simultaneously. However, more tailored approaches with a strategic rollout will be more effective. So how can we best identify? And then, of course, to Matt's point as well, those existing interventions, and I mentioned this earlier, how are they actually influencing connectivity risk? And we don't even know it. Can we bolster the things that are already out there instead of recreating the wheel? And I would think most important to all of these questions, of course, is who are we reaching? Are we reaching those who are isolated, lonely, both, depressed, etc.? And how is it, who are we missing? That's the question. Who are we missing? How do we identify and engage those that are not being identified through our normal channels?
I think it's always really critically important to, when you say who are we missing, identifying those who might be most vulnerable, as well as those who are underrepresented. And we have seen even in the science that there are, we have more evidence on some groups than other groups. And so we know more about some groups than other groups, and that also needs to change. We need to better represent everyone in the science and in the solutions, and particularly those who may be most at risk. So continuing on this line, we're with this challenge of COVID-19, there's a sense of urgency also that we need to come up with solutions, and we need to act now. And in many cases, our actions are ahead of in some ways of the evidence, because we're still learning a lot about the unique features of COVID-related social isolation and loneliness. So based on your own area of expertise, do you see any potential missteps in our collective response to COVID? Are you concerned about any adjustments to COVID that may have unintended negative consequences? Louise, you're smiling like you want to talk. Jump on in.
It's a loaded question. I mean, I think of children being exposed to the quarantining, the being careful to be physically distant, and the lessons that they come away with. How does that change their perspective of the world and the safety of the world and the people around them? And it goes all the way through to older adults. But at the same time, I think we do well to think about the flip side, that people can be resilient in spite of these circumstances. And we have lessons to learn from people who managed to make a good thing out of this lemonade. It's not easy, but I think taking the flip side and looking at strengths that people bring to bear that bring lessons out of this experience for all of us to benefit from are going to be worth looking at.
And we've already seen some preliminary findings suggesting some degree of resilience. And so, there is some hope, certainly. But I'm sure many in the audience and many partner organizations want to make sure, that what they're doing is going to help, right? And are there any concerns that our well-intended efforts might either fall flat or worse yet, potentially cause harm?
Yeah, I would say that is a risk. I think Matthew's raising his hand. So, go ahead, Matthew.
Well, if you allow me to, I'll answer everything. So anybody else, please don't let me. Well, one thing I would say, of course, is that one of the unintended issues that obviously came up with COVID was that everybody got into survival mode for their own organizations and started focusing on what it is they do instead of actually thinking systematically in a systems thinking approach. How can we collectively pitch in? How can we leverage the limited resources? How can we actually, since we all have touch points for these individuals across many sectors, what can we do differently? I think the thing that also maybe was a little of a misstep, of course, but it's naturally necessary, is the technology. I feel like that's one of the biggest research questions coming out. But now the reliance on technology, the question becomes, do we have enough education about how to get it into the hands of the people and have them use it effectively for their benefits? Because I think we're missing that opportunity now. We just said everything goes virtual, everything goes to Zoom, everything goes telephonic. But how did we get those to the right people and show them how to use it?
Well, and whether those tools are effective. I think certainly this has brought up the issue of not only access, but the skills and desire to use these tools. Frankly, when it comes to digital tools, there's so many, right? And from some of the evidence that we do know is that there's variability in terms of how effective these are. I see Kelly nodding. Maybe you'd like to add something here.
Well, I just absolutely agree. I think it's a double-edged sword that we're well aware of. And I want to say I just appreciate all of this. I think the other thing that we need to keep in mind too, this is a little bit of a change of topic, but is this idea that, I think from a research standpoint, it has to be rigorous. We have to define things very precisely. At the same time, we're at this incredible moment where there's this confluence between the pandemic, awareness of social justice issues, we're at this incredible intersection of everything. And even while we're what I have seen in my own work is that oftentimes people get so tied to precise definitions that they miss the bigger picture. And I think, you know, especially it's so critical right now. Oh, also with the election, we're at this critical moment where we need to be having a civil discourse, and, you know, loneliness ties right into that, and thinking about how we want to go forward. You know, I'm encouraged that this is really a big change. And just exactly as Matt said, I mean, I feel like there's been the curtain has been pulled back on this, and I think it's the time to move forward within organizations, within the research, and within all the work that us as individuals do as well.
And if I could
Very
just
well
add.
said. Go ahead,
Yeah,
Louise.
sorry. Yes, I agree. I was going to just add to that how intergenerational contact builds into this, because ageism has been an issue, continues to be an issue, and social isolation has typically been thought of as an older adult issue. But now the curtain has been pulled back, as you say. We're all appreciating that social isolation is real. Its effects are profound, and it isn't just the older adults that might help motivate action forward. I do want to reiterate David Brooks's message, and he talks about trust. When we were studying loneliness and trying to understand the different dimensions it has, we identify at least 3 different dimensions, which we call, you know, an intimate type of loneliness, which is a lack of a partner typically, a relational connectedness deficit, which is not having confidants that you can share important things with, and a collective connectedness lack or loneliness, which is feeling that you're not part of a group. What is that group? Anything that's important to you. And playing into that is all the peripheralized communities we have in our society, whether they're racial ethnic minorities or LGBT or disabled or whatever it might be. There's certainly ample reason for them to feel disconnected because there isn't a place for them at the table in a lot of ways. And what's common among all these different types of disconnectedness is a lack of a sense of safety or security. And where does that come from? It comes from trusting people and having people trust you. So if you can't feel safe and secure, you're not trusting them. If you're not trusting them, you have to watch your back. If you're actually in a trusting relationship, those people are watching your back for you and you're watching theirs. We have to be able to get to the point where we can nurture that potential in our society, where we have strategies, approaches from the national level on down that remove obstacles to and actually nurture opportunities to create a safe space at every level where we don't feel we have to be distrustful. And the intergenerational dimension is one arena in which we can remove the barriers and start creating a society where we all share outcomes.
Thank you so much. That is really incredibly well said, and I absolutely share your thoughts on that. I have one final question, and we're short on time, so we may not be able to hear from all of you, but I think your remarks really lead nicely into society and what kinds of societal approaches, and I think this ties back into policy. And so as a final question, if given the opportunity to push forward one specific policy recommendation related to social isolation and loneliness, based on your research, what would it focus on? Anyone?
I'll say mine quickly. Both on an individual and organizational level, be kind. It goes a long way. It sounds simplistic, but it's sort of what all the research comes back to.
Louise, did you have anything to add?
Yeah, just one thing, and it sort of reminded me of how depression used to be this very stigmatized state, and you never admitted that you were depressed. It's now okay. It's become something that you can acknowledge for what it is, and there are various therapies you can use for it. Loneliness is still a stigmatizing state, but it needn't be. It's a signal like hunger. Hunger, you're nutritionally lacking. If you're lonely, you're socially lacking. And you don't want to end the signal, but you do want to deal with it when it arises. You want to fix that. You want to feed yourself, and it won't be a one fix for all time. It's, you have to keep feeding, you have to keep eating, and you have to eat nutritionally, socially healthy foods to meet those needs.
Thank you. Yeah, certainly I think this pandemic, one of the silver linings is that it has brought a lot of awareness to the importance of social isolation and loneliness. And but we need formal education, not only in terms of the established, well-established health effects, from K through 12 to medical school training. This needs to be part of not only the national conversation, but more formalized. And so unfortunately, we need to wrap up our panel discussion right now, but I want to offer my sincere thanks to the panelists, my Scientific Advisory Council colleagues, for both their time today and for sharing your most valuable perspectives. Also, thanks to the Coalition and the Foundation for bringing us together. And I will now turn the time back over to Eddie for our next agenda item.
Wonderful. Wow, what a robust conversation. Thank you, Dr. Holt-Lundstedt, and to all of our council members. We're so fortunate to have you, your leadership, and to that of each of the scientific advisors to help guide our policy advocacy, our campaigns to raise awareness, and our work collectively to make a difference in the lives of all Americans, as you all mentioned. We're excited to see what's in store for the work of the council. However, before we move forward to our next session, I'd like to take a moment to acknowledge the inappropriate and completely offensive racist and bigoted slurs that were used in the chat during the last panel session. The sole intent of the Action Forum remains to foster togetherness and collaborative action of all people. The Coalition, our partners, and every speaker here today are genuinely dedicated to representing and tackling diversity, equity, and inclusion in our work now and moving forward. We sincerely apologize for what transpired in the chat, and we have disabled that function for the remainder of the 2 days. We apologize. Up next, we have an exciting panel focused on the Coalition's recent efforts to establish a global collaborative on social isolation and loneliness. The global collaborative will explore best practice sharing across nations, dissemination of research and programs, and opportunities for a global awareness campaign. We are fortunate to have one of the most formidable voices on social impact, Lisa Marsh-Ryerson, as the moderator for the panel discussion. Lisa is the president of the AARP Foundation, the charitable affiliate of AARP, a bold, disciplined, and collaborative leader. She sets the foundation's strategic direction and steers its efforts to realize an audacious vision, a country free of poverty where no older person feels vulnerable. Since she took the helm of AARP Foundation, she has implemented pioneering initiatives, explored new avenues for collaboration, and secured unprecedented funding to support programs and services that truly change lives. Before joining AARP Foundation, Ms. Ryerson served as the president and CEO of Wells College in Aurora, New York. Again, we're so honored to feature this panel and to have Lisa as our host. So thank you, Lisa.
Thank you, Eddie. It's such a joy, a real gift in this time to be with you, and to thank you, Eddie, and to thank Andrew and the Coalition for convening us for these critical conversations. I have to say, I am just enjoying every moment of the conversations that we've been having. As many of you know, we have been working at AARP Foundation on addressing social isolation and loneliness for over a decade. And we have had the good fortune to work with so many of you individually and also with your organizations. And I'm delighted to learn from those of you whom I haven't had a chance to meet yet, and to see ways that we might be able to work together. I'm also this thread in my mind is a comment that Andrew made in the very opening, that this is an action forum. So we're learning about all of the science and the research and the questions that have been asked over decades, 4 decades of research in this field, solutions that organizations and individuals have mounted, and that if we do so with an action orientation and address social isolation and loneliness in the way that the coalition asks us to, calls us to, as Andrew said, it really will help us have a return on our humanity. I'm also mindful that we're coming together with what will be a great panel, I can assure you, of international leaders in this space during a time of great pain, as was mentioned on the earlier panel, the pain of converging pandemics, COVID-19, systemic racism and discrimination, and also economic downturn. But as has been said throughout today's conversations, this is also a time of potential, because there is this heightened awareness around social isolation and loneliness and around those who have been marginalized and have suffered the most. So there is a way for us to come together. AARP Foundation was happy to sponsor the NAS study that Julianne referenced, and we also just launched a survey with United Health Foundation that confirmed what you all have been saying, that in the United States, 2/3 of adults, actually 18 and over, report social isolation during this period and heightened anxiety as well. So let me start with our first panelist. This is a leader who has informed the work at AARP Foundation and the work of many, many organizations around the globe. I'm delighted to introduce to you Paul Can, co-founder of the Campaign to End Loneliness. Paul.
Hello, and thank you very much.
Good to see you.
Great honor to be here. Hello, everybody. Now, I have to try to compress 20 years of experience and endeavor into 5 minutes. So please, I'm asking you to pain, but I shall do my best. It was one of our great political champions of the campaign, Jo Cox, MP, who in her first speech to the House of Commons said, "We are far more united and have far more in common than that which divides us." And it was that expression of our common humanity that I think is the big message from us tonight. Could I have the first slide, please? In a nutshell, the campaign we launched nearly 10 years ago is 2,500 members who listened to the heartache of so many people and wanted to act, with 4 leaders of leading charities, not-for-profits, who prepared to, if you like, submerge their identity, submerge their organizational ego in order to promote the bigger message about loneliness. And we had one funder with a great vision who was going to be there for the long term. We were determined to name the demon of loneliness, the disabling gap in so many people's lives. And we will not shrink from focusing on that single word, loneliness, that emotion cluster we call loneliness. We were determined to use the solid foundations of research, and in that we were helped crucially by eminent researchers, several of whom we've already heard from tonight in a very, very inspiring panel session, I may say. We were also helped accidentally and tragically by the fact that that very same political champion, Jo Cox, was brutally murdered 4 years ago. And in fact, that awful generated waves and waves of compassion and commitment. Can I have the next slide, please? Many challenges and many disappointments, but I hope we could feel that awareness of loneliness in the public has been raised a lot. It's out there very widely, we're talking about it. A lot of funding has been brought in to fund different initiatives to loneliness from various sources. We have won political attention, serious political attention, and we now have not only a minister for loneliness in the government, but we have a 60-point loneliness strategy. It's not perfect, but it's a great start. The not-for-profit agencies have really woken up to this, and I hope we've started to generate a social movement, which campaigns of high profile and some impact, like Be More Us, Happy to Chat, Let's Talk About Loneliness, they've all moved us forward. Could I have the next slide? Challenges on the way, and we've heard about these tonight, is how do you find the people who are lonely? How do you find the highest risk groups? So we've invested a lot of time and effort in analytical tools like heat maps, like indices that will find us those people at most risk of loneliness. Secondly, how do we promote the best that tech can offer us, which is a lot? Avoid this challenge of, as your Sherry Turkle put it, us being alone together. Of course, during COVID, we had a massive political problem, and the digital divide, which is already huge, became a digital chasm. Some of us could enjoy Zoom quizzes and virtual choirs, whilst many people became even more isolated. How do we not get dragged into this pointless debate about who is younger or older people? We know from research that there is a U-shape age curve to loneliness, and it's a universal part of what we are as human beings. And then I think the biggest challenge we have at the moment is keeping the momentum up when 10 years on, a bit of fatigue is setting in, a bit of resistance to the word. And around all of that, we have these giant issues of how we deal with care and well-being, how we deal with poverty and social exclusion, that terrible syndrome which your Dr. Robert Butler pointed to called ageism. And finally, how do we personally look out for our own convoy, our own self-protection? So those are some of our toughest challenges. Next slide, please. So on our to-do list right now, in COVID, found that a flame of kindness was sort of sparked. How do we keep it going? We do have a lot of knowledge about communities, what makes better, kinder, more connected communities. I was very inspired by David Brooks's reference to weavers, such an important idea. How do we do that? We have a new policy in the UK called social prescribing, where doctors are meant to give out fewer pills and signpost to more activities and more social connection. Will it work? Can we make it work? It's a great idea. We have two big reports. One we've recently launched about how do we deal with what is within us, what's inside us, called the psychology of loneliness and what we can do ourselves. And next week, we're launching a report called Approaches to Tackling Loneliness, which is about what public and private agencies can do. It's about the frameworks we put around our individual efforts that need to be personalized, that need to be tailored to what people want. And of course, what we're most about now is supporting everybody and learning. And so to my final slide, We just want to learn from you. We would like to go on being inspired by all of you. Some experience to share. We've got an awful lot of struggles and mistakes we could also share with you. We want to work together because we want to strengthen advocacy in order to get action that will promote better lives for more people, so that more people will feel, as the writer Olivia Lang put it, we're in this together. What matters is kindness. What matters is solidarity. And I sincerely and warmly hope that we can reach out to each other, and that you will find us and that we'll find you. And I've given you some links which will help you with that. Thank you very much.
Thanks, Paul. We'll look forward to you returning for the the panel discussion, but I very much appreciate all you've done to put forward a framework, as I said earlier, that so many of us have used, and also for your focus on the multi-sectorial framework that you've used to really address the challenges in the UK in addressing loneliness. I'm now delighted to introduce another great colleague from Brazil. Please join me in welcoming Adriani Mena Barreto, who is the COO of Saúde Criança in Brazil. Adriani, how wonderful to see you.
Lisa, thank you so much. Oops. Okay. Thank you so much. Wonderful to be here. Good evening from Brazil. And it's a great pleasure to be here to listen and to learn, and also to share with you a little bit about our work at Data Institute. It's former Saúde Criança, a Brazilian NGO. Next slide, please. So Brazil, next slide, please. Thank you. Brazil is one of the most unequal countries in the world. And we have people who live in comfort and enjoy the riches of our beautiful country. But we also have those who have nothing, who live in poverty, but hope for a better life. 15 million people are in extreme poverty in Brazil. About 40% of Brazilian houses are considered unhealthy with no basic sanitation. The consequences of the inequality are severe. Violence, fear, poor health, lack of work, isolation, and loneliness. And this affects everyone, rich and poor. Next slide, please. 29 years ago, Dr. Vera Cordeiro, our founder, worked in a public hospital in Rio de Janeiro in the pediatric department. She witnessed poor children living in a vicious cycle of misery, illness, hospitalization, back to misery, and many times rehospitalization, sometimes even death. And she understood at that time that it is in health that the cruelest face of poverty appears. And to address and really heal, it was mandatory to understand the living conditions, to think and act in a multidimensional way, to reach deep for the causes of the diseases and break that vicious cycle. Next slide, please. So Instituto Data was one of the pioneer institutions working with the social determinants of health. Over these last 29 years, listening to vulnerable families, we developed with many volunteers and national and many international institutions, a very powerful methodology that works in an integrated way. And it creates a virtuous cycle, addressing 5 areas: health, education, citizenship, housing, and income generation. This methodology, the Family Action Plan, promotes health, human development, and social inclusion. Next slide, please. Today we receive in our headquarters 310 families per month. They come for important moments of co-creation with the team and with other families. And one of these special moments, I like it a lot, is the participation in community therapy sessions, where each one helps the other with their challenge, with the challenge they are living. We have different sessions for adults, for teenagers, and also for mothers with newborn children. This is a very important moment in the fight against social isolation and/or loneliness. And these moments are so valued that some families that have already graduated from the program, they have replicated this model in their own communities, reaching even more families. And also very important is the technical support that the families receive. We have a team of employees and volunteers that listen to families with empathy, understand their uniqueness, and provide information and guidance. It's a multi-sectoral and integrated team of social workers, psychologists, doctors, nutritionists, educators, lawyers, and architects. They help families overcome their challenges, help them navigate the healthcare system, and even to have healthier homes. They refer them to professional training courses so they can develop their protagonism. And most of all, they help them access their rights as citizens. This year, this multidisciplinary team had more than 9,000 appointments with these 310 families. We were able to maintain our work even during the pandemic, in a hybrid model, of course, with many virtual sessions. And we are certain that this was fundamental, not only for families, but also for the staff and group of volunteers, also in social distance because of the quarantine. The information and orientation that we were able to pass on to our social isolated families was crucial for preventing from COVID. Technology is fundamental in all this process. In an integrated way, all information collected goes into our monitoring system, where all the challenges and the evolution of each family is kept. And this is how we measure our outcomes and our impact. And next slide, please. Georgetown University proved the long-term impact of our methodology. They conducted an independent research, and 3 to 5 years after completing the program, our families continue to improve. The family's income almost doubles, and the average days in hospital falls by 86%. The negative perception of well-being decreases in 83%. And there's also an increase of 79% of families that own their own homes. Our methodology is spread out throughout Brazil, and since 2010, it is public policy in the 3rd largest city in the country, that is Belo Horizonte. We are now working in partnership with the federal government of Brazil in a technical cooperation. And besides that, overseas, we are implementing this methodology in a community in Baltimore in a great partnership with the University of Maryland. And Dr. Yolanda Ogbolu will share more of this partnership, this great partnership on this forum tomorrow. And as our work influenced many entrepreneurs around the world that came to learn with us, we understand that we have reached more than 1 million people on 4 continents, but yet we want more. And we dream that the Data Institute's methodology, partnering with other wonderful methodologies around the world, will help even more people. Wherever there is an isolated family needing to overcome poverty, become the protagonists of their lives, and feel they are an important and recognized part of society. Thank you.
Adriani, thank you so much. It's really terrific to learn so much more about the work at Data Institute, and also your people first, person first solutions development, really looking at families holistically and at communities, and lifting forward isolation and loneliness as a critical social determinant of health that is related to income. So we'll look forward to more conversation with you a bit later. I'm now delighted to welcome our colleague Janis Kuhlencourt, who is the founder and project lead of the Togetherness Hub in Germany. Janis, it's good to see you.
Good to see you. Can we please move to the first slide? Wonderful. I have to admit, it feels a little bit funny talking to you right now, representing the status quo of what is being done in Germany to tackle loneliness. The thing is, I don't consider myself a loneliness expert yet. I don't represent a research institute or a large non-profit organization. Today, I represent the Togetherness Hub, a rather young initiative born during COVID-19. So you might say we're not even out of puberty yet. Exactly, that was right. Moving on to the next slide. So what's our journey? 7 months ago, we started to ask ourselves the question, what is being done in Germany? Or to put it differently, is anybody out there? And we soon ended up with a rather saddening truth. Moving on to slide 2. Well, there are some great initiatives tackling loneliness, especially for elderly people. In general, we're facing a lack of awareness, a lack of research, a lack of funding, a lack of collaborations, and a lack of feasible solutions to tackle loneliness in Germany. And this is a rather disturbing truth. And so setting the benchmark quite low for me to be indeed on this panel as one of the experts on loneliness in Germany by now. You might think loneliness has been a thing before COVID-19, and now it's even more a thing due to increased social distancing measures being imposed. Well, not that much in Germany. Here, the Center of Gerontology comes to the conclusion that loneliness is not increasing, unfortunately based on a study design which leaves out people older than 85 plus, doesn't consider people younger than 40. We had the U-curve in the first panel from Campaign to End Loneliness. And I can promise you, I'm not 40 years old yet, or 40 years young yet. So realizing that something needed to be done rather yesterday than tomorrow, we've reached out to initiatives around the globe to get a better understanding of what we're facing, who we can learn from, and how to overcome loneliness. And once again, we've been shocked, not by the huge number of helpful initiatives and individuals with astonishing ideas, some of them right here in this panel, but rather by the huge number of practitioners who reported a lack of collaboration and a lack of platforms for knowledge exchange, both across industries and across borders. So moving on to the next slide. Here are some numbers from a survey which we've set into motion to test our hypothesis that there is indeed a lack of collaboration going on. And it's not just a hunch based on those expert interviews. So we've sent out our survey to initiatives tackling loneliness, and the results are pointing in the most obvious direction. So you can see we have 9 out of 10 believing collaboration is necessary to resolve loneliness, but also a vast majority confirming that they experiencing a lack of collaboration. Counter-checking this one with 9 out of 10 wishing for more collaborations being established for themselves. So all of you probably know, putting things into perspective, collaborations are not always easygoing. 2/3 have reported that they had difficulties while working with other partner organizations in the past. And what we've been taking away from that is we need an international platform and community to overcome loneliness. But what we also need is a framework for more satisfying collaborations to be established. Moving on to the next slide. This is basically where this event today comes in and why I'm so excited to be on this panel. We can work magic, we can collaborate, we can support each other, and we here in Germany can learn so much from all of you out there. And so I'm really excited for how this panel proceeds. And moving on to our final slide. This is what we're basically doing and where the Togetherness Hub concentrates the efforts right now. We believe we need to think beyond Germany. We need to think beyond borders because we need to act globally and we need to act right now. So what we're doing is we're currently creating the first global community which allows various stakeholders across industries, so not just researchers, but also health insurances, interest groups, therapists, company representatives, and many more, both for-profit and non-profit, to share tools, best practices on how they are tackling loneliness and how to manage daily operations. And there is so much we can learn from each other. We are creating this platform so that the latest research can be shared from various countries, not just Germany, not just the US or UK, and that it's being made available and visible. Where we can celebrate our combined efforts during festivals, inviting musicians and filmmakers who are also diving into the subject matter of loneliness and can raise awareness. Right. Where we develop new ideas and solutions during hackathons with talented designers and developers supporting us. as you can see, this is a rather huge vision and we can't do it alone. And this is why we're part of this panel today.
We're thrilled.
Loneliness can only be solved together. So join us, reach out to us, and let's have a fantastic panel ahead of us. On a final note, I brought a question which I hope we will be positively surprised of. How many international collaborations do you take part in, which you consider mission critical for your success?
All right, let's have participants answer this question. And as they are, Giannis, I would say thank you for your generous comments. And it's a reminder to us that innovation will be key to our success as well. And that's really what you're focused on. So how many international collaborations do you take part in, which you consider mission critical for your success? Terrific. So what we're seeing from the results as they come in is that we have a lot of opportunity here, Giannis and panelists. We have definitely attendees who are already in active participation, but the majority have not yet established an international collaboration. So a lot of opportunity, work ahead of us for the panel. I'm happy now to introduce another terrific colleague. We have with us today Amy Westland, who is the chairperson of HelpAge Canada. And I know at AARP Foundation, we always enjoy our collaborations, Amy, with HelpAge.
Thank you very much, Lisa. Thank you for, I too am very pleased to be part of this panel and this initiative. And we'll take my 5 minutes just to say a few words about our journey on trying to address the issue of isolation, social isolation and loneliness, particularly amongst the elderly in Canada. So if we could move to the first slide. So HelpAge Canada, we are a charity that has both national and international reach. In Canada, we have been focused for several years on trying to address the issue of social isolation and loneliness amongst seniors, particularly of limited means. We also, though, are a founding member of HelpAge International, which is a hub of a network of approximately 80 international organizations that are focused on older persons. And there's a dialogue, of course, going on, as we've touched on already today, about addressing this issue for older persons globally. So, I mean, our vision is of a world in which we can once again have older persons fully enmeshed in the fabric of our society, where we've reversed this trend towards increasing isolation and loneliness, and where we see older persons growing old with dignity and able to participate socially and economically and live actively. So if we could move to the next slide. New research, which nobody here will be surprised to learn, is showing that in Canada, our elderly population is growing increasingly lonely and isolated. So, of course, it's partly that as spouses die and children grow up, people are left alone. Recent statistics show that approximately a quarter of Canadians over 65 live by themselves. So as many as 1.4 million have reported feeling lonely, which, as some of the medical people in the medical field were speaking to, more studies are coming out showing that this is leading not only to health issues sort of indirectly through the increase in depression and desperation and sometimes actions that are neglectful of one's own well-being, but also more directly linking it to higher blood pressure and sleep issues and so on. So which we are not, of course, surprised to learn because, of course, humans are inherently social beings. But it is interesting that we've seen, and statistics are starting to confirm just the strong link between, for older persons, the loneliness and isolation and low income. So, for example, in Canada, approximately 23% of Canadians recently reported to a Angus Reid study that they considered themselves very isolated and very lonely. They were called a desolate category. And within that group, Canadians who were 55 and older and had low income, income of less than $50,000 a year, were 2 times as likely to be in that group as Canadians with higher incomes. of over $100,000 per year, for example. So we do believe and see through our partner organizations, because we're a national organization that operates in partnership through community organizations who are working on the ground. Obviously, there are some key physical barriers that older persons face that prevent them from participating and communicating with families and friends. So that's part of the issue. And then also disabilities generally, which I'll say a little bit more on the next slide, if we could switch to that. Actually, just back up one slide, please. So we have, I'll touch on these briefly, but 3 programs that we've been trying to move forward to address this issue. We started in 2015 with RISE, which was a social awareness building campaign trying to highlight the issue and encouraging Canadians to think about it and reach out to isolated and lonely seniors and their families or communities. And we've kind of stepped away in the last couple of years from that, because now Canadian governments have started to step in and raise awareness, and lots of organizations are raising the awareness, but the solutions, figuring out what the solutions are is what we've been trying to tackle more as an organization. So we have 2 programs that we are more recent, within the last year and a half or so. About a year ago, we launched Seniors Can, which is a grant program which is designed to provide grants to individuals to try to address a range of the issues that are creating barriers for them in terms of participation and communication. So we call them, there's accessibility grants that cover things like hearing aids and wheelchairs, things that can be physical barriers to participation, well-being grants, things like grants for transportation to social activities, and then other forms of grants, for example, supporting the activities themselves that focus on older persons. And then most recently, we have Seniors Can Connect, which is a digital literacy program aimed at lending configured tablets to older persons, and also sending in people who can train those older persons about how to use the tablets and use them to connect. So just one more minute, if you move to the next slide. What we are learning, and we look forward to talking about with our colleagues, is about how these solutions can be tailored and improved. We are seeing that we think a holistic approach is required, a holistic approach that is also tailored to individuals. We think tackling this issue is key to developing a more compassionate and resilient society, and the issue is multifaceted, and so the solutions have to be multifaceted. So we find that working with a variety of partners who address a variety of different aspects of an individual's life is going to be necessary in order to try to build a community of support around each lonely and isolated individual. And through slowly building those communities of support, we hope to help to foster the connections between people that will ultimately help to reduce the isolation and the loneliness. And so with that, thank you, and I look forward to the discussion.
Thank you so much, Amy. And I think your focus on the challenges of reaching hard-to-reach populations and the need to have both multifaceted solutions and multi-sectorial approaches is something we'll discuss more. One more poll question. People are most likely to want to help with combating isolation and loneliness among seniors if they believe. So if you'd quickly read that list, and let's see what the answers are from the group of participants. And as we're waiting for the responses, I'll ask our final panelist to introduce her work and her organization. We're just delighted to have Michelle Lim with us today, who is the co-director of Ending Loneliness Together in Australia. We are a truly global panel today. And what we see, Michelle, before you begin, is that yes, this is great. People are most likely to want to help with combating isolation and loneliness among seniors if they believe that every individual has the right to dignity and respect, closely followed by caring for older persons builds a more compassionate and resilient society. All right, Michelle, the screen is yours. Hi, Michelle.
It's a privilege to be here today. Thank you, Lisa, for moderating this forum. I am part of Ending Loneliness Together, originally known as the Australian Coalition to End Loneliness, and I am saying hi today from Melbourne, Australia. So this organization actually started in 2017, but we're actually going into a formalized structure and with appropriate governance and structure in 2020, and we're actually going to be launching an online forum at the end of November, as well as our first white paper on understanding loneliness in Australia and how data can be translated into policy and practice. Next slide, please. Okay, so in terms of what our key focus area is, what we really want to do is really, first of all, develop a strong evidence base. As you guys have heard earlier on, the science and the nuances of understanding the differences between loneliness and social isolation has to be understood across all sectors, but also we need to use the science to actually then properly translate into effective solutions. And I think, you know, as scientists as well, we can do a better job in doing that. And speaking as also the scientific chair of Ending Loneliness Together. What we also want to do is also inform and equip the public and all service providers out there. If they're in the front line of actually encountering people who are lonely, what do they do? How do they identify loneliness? Where do they send them? And I think that's a massive gap in Australia at the moment. And of course, you know, it's really important for us to influence government, not just on the local level, the state level, and the federal level, to really understand how we can coordinate a national response to loneliness. And we've been very lucky to have been, I guess, supported by the UK campaign to end loneliness and actually looking at the trajectory and how we can actually influence these stakeholders. And of course, we want to inspire. I think this has been said quite often, is that we really believe in actually the active participation of civil society, empowering the voices of people who are lonely, but also to empower people who are less lonely. And I say the word less lonely because it's not possible that you're not lonely at all, that you're less lonely at this point in time, to actually help people who actually require a little bit more assistance. Next slide, please. So this is an example of how we can integrate the diversity of different voices to address loneliness. So this 1000 Voices project, for example, is on social media right now, and you can actually follow the movement, where we're actually portraying different kinds of people from different cohorts to actually showcase and almost address the stigma and trying to reduce the stigma of loneliness to begin with in the face of who we think is lonely. For example, you know, in our first post, it was very much a young doctor who is actually working in emergency over here, and this is not the face of what you imagine someone to be lonely, but he talks about you moving from place to place, being an only child, and actually battling loneliness constantly and how he actually copes. So it's trying to bring forward the voice of who is lonely. And in doing that, we can really reduce stigma and actually allow people and socialize people into this idea that they can say, I'm lonely, without judgment. Next slide, please. So what do we know? We know that loneliness was an issue before COVID-19. 1 in 4 Australians, in fact, reported problematic levels of loneliness. And in a global study, together with Professor Julianne Holt-Lunstead, we also found that 1 in 2 Australians and 2 in 3 Americans and British people actually reported that they felt more lonely during COVID-19. And so obviously, you know, loneliness, again, it's a problem pre-COVID-19, but it's really a signature concern in post-COVID-19. Next slide, please. Next slide. Yeah, thank you. So what our next steps are, in addition to the formal launch of Ending Loneliness Together in November 2020, what we really want to focus on now is things like building community awareness. Do we actually even develop an evidence-based national campaign to actually build or socialize the Australian community into the effects of loneliness and what they can do to actually overcome those things. And again, not just talking to the lonely person, but also empowering other people who are less lonely at that point to actually take very small, feasible, discrete actions so that they can actually help other people around them. Again, this is back to education as well. And it's not just education within our community, but also education around services, people who don't understand maybe even the difference between loneliness and social isolation, people who are in the front line. And we do have to, going on to number 3, work with those services. We need to be training our health practitioners, our mental health practitioners, our community social services on how do we identify if someone's lonely. Just because they're social isolated may not necessarily lead to loneliness, even though it's a risk factor. How do we monitor their progress within formalized programs? How do we direct them or redirect them if they're coming into contact with people who don't provide direct services or solutions? And one of the biggest challenges that we have is number 4, is that I think this has been a common theme, is that what we're trying to do as a peak body for loneliness is to bring everyone together so that they know where to go. And people are doing different things. And actually, we don't have any kind of national database of who's doing what. And this is something that if we can build a national mapping to a database to survey how people are going, to promote evidence-based services and programs that are underpinned by strong frameworks and evidence-based solutions, I think that would be a fantastic way to proceed. So I will end my presentation here for Lisa. Thank you.
Thank you. It is, as I heard you talk about the fulsome body of work, it really resonates, as you said earlier, with so much. So I'd like all of the panelists to come back on camera for a conversation. But Michelle, your words resonate with what we've heard about how challenging it can be to both identify those in most need. How do we address isolation and loneliness as social determinants of health in an integrated way? How do we come up with evidence-based solutions and then develop those closed loop systems you've all talked about so that we know what has been effective and what care and support individuals are receiving and what the outcome of that is. So I'd love us to talk about how we can enhance the ability to work globally. And I'm going to ask each of you, and I'll return and start back with Paul. When you think about your body of work and addressing isolation and loneliness, talk about a very promising practice or solution, and then how you think that might be applied in a more global context. So Paul, I want to begin with you.
Thank you very much. We are publishing this report next week called Promising Approaches to Tackling Loneliness. And it's a kind of collection of ideas. It is not a shopping list. It is not saying if you do one of these, you've got it sorted. Right. Because I think the most important thing that we can do is adopt a framework that is system-wide. You know, we all have different things to do. We've got what the local state do, the local health services, local government. We've got what national government can do or not do. Sometimes disables more than it enables at national level. We've got communities and all that is in communities. And we've got ourselves. And we think that it is a framework of bringing all these things together and connecting at local level that is more important than individual ideas. And I love some individual things that go on. I've been very inspired by the things that you guys do. We've had a thing in our country about people coming together for a really riotous lunch club called the Club. We've had a running club, which is a befriending group because runners go out and have they're typically young people. They go out and they call in on older people. That's great too. We've had groups focused on bereavement support, and could be any one of a number of things. But the important thing is to have that sense of a framework. We're all in this together. All the players have a part to play.
Yes. So I think that's important, Paul. So really your recommendation globally then is just that a framework approach, really identifying and calling out assets and how various groups and individuals and sectors can then intervene. Have I?
Absolutely,
Right.
absolutely. And to use what some of the learning that we've had. I mean, Professor Hollander, who was on earlier,
yes,
with her 15 cigarettes a day.
Yes.
I have to say that is the most wonderful example of a totally evident soundbite.
Yes.
And it's had huge, benign, helpful effect.
Yes. I think Julianne likely has a lot to say to all of us about that and how we use that. But you're absolutely right. It drew such attention in building awareness to the damaging effects on overall well-being. Adriani, how about from your perspective? You were really working across generations with fighting extreme poverty and connection to those resources. What is the most promising solution, and how might we apply it globally?
I think Instituto Data always worked in a network, right? As we have a holistic approach, and it's impossible to go deep in each one of the 5 areas. So we understand we need connections, and this is how the work is done most of the time. So I think, for instance, in education or in housing or in psychology, in each areas, it's important for people to be connected, for organizations to be connected, because there's always someone that works better in that that specific need of that family, right? So we don't have to discover everything again or do everything again. So the best way to get better results is to have this connection. And this is something that we really believe in. And I agree with the framework, and this is awesome.
Yeah, it sounds like your approach has been just as Paul's is, that you need to, you're testing and learning, but ultimately developing a framework. It's not lost on me, group, that as we talk about addressing social isolation and loneliness, we're saying the very approach has to be rooted in connection, right? Connection with resources, connection with one another, with nations around the globe, with people with whom we're working. So Giannis, how about you? That's kind of what you're doing, I think, building a collaboration incubator in some ways. What have you found in early days to be really promising?
Lisa, I couldn't have summarized it better than you did prior to it. I couldn't agree more. I saw Michelle nodding. Paul, what you said about the framework. I mean, if you would ask me, okay, what is the one thing? It's rather a long shopping list.
Right.
There are so many great ideas I've encountered starting on this journey, looking at what is being done in Canada, in Brazil, in the US. So talking to also people from organizations which are present in this panel. And so for me, it's difficult to pinpoint it to one initiative.
Sure.
We kind of have this pillar structure in mind. We say you have basically awareness building, you have acceptance building, and you have the call for action. So on one hand, that, for example, in Germany, we have a strong awareness when it comes to loneliness of elderly people, but not really a lot of awareness built around loneliness, which is being experienced by younger adults.
Sure, across the life course.
Exactly. And so there are amazing awareness campaigns which can be kind of translated to German and just being distributed in Germany. Same goes for kind of measures which focus on reducing the stigma around loneliness, that people can open up, that they feel vulnerable, creating safe spaces.
And empowerment to really accept when there is reach out to support them. I think you're absolutely right, Yanis. And Paul, I'm smiling because we have all shamelessly adopted your campaign approach, which really led the way for so many of us. So thank you to you again. Amy and Michelle, I'm going to switch up the question for you, which is, as I hear Adriana and Yanis and Paul speak, there are multiple approaches. There is not a one-size-fits-all solution. Nonetheless, we want effectiveness. So as you're building a body of work, how do you figure out, what's in and what's out? There are so many solutions in search of a problem as opposed to just going to that root causality. So Amy, I'll start with you.
Well, I mean, I think at this point we are not yet at the point where we're figuring out anything that's out.
Okay.
In the sense
New days.
that, because I think that, like so many of the others have said, we have to address this issue from so many different angles. I would say that we're more at the point of figuring out what's in. So on that, I would say, we're seeing that, again, in terms of like, how do we take awareness and then turn it into some actual solutions? We're noticing, because we work with partner organizations who are dealing with, in our case, older persons on the ground. And so you have to have someone, by the time they're coming to us and asking for one of these grants, for example, someone has taken the time to identify this vulnerable person, to go, spend extra minutes of their day to fill out this application, all from a place of caring or kindness, like we spoke about before. And I think that so what we're trying to do is foster our connections with those organizations where people are willing to go above and beyond based on some kind of sense of caring. And so I feel that what we're seeing is that we need to figure out how to teach this. It's not just about learning, but actually teaching each other about how to foster that feeling of caring and that willingness to go above and beyond. Because I think one thing that we've seen, we're always dealing with it with older persons, trying to get people, we would lament in organizations like the HealthAge International Network that getting people to worry about older persons. And I think the thing, it applies too to lonely and isolated.
Sure.
It's not as easy as having a fuzzy, panda bear or, the Amazon forest where people feel a sense of caring. There really is this stigma or these judgments, I think, that people make.
Well, and to be seen, right, Amy? What you're talking about is so much resonates back to the opening for people to be seen. But I think what you've done successfully across the HelpAge network is also really tap into the agency of older persons to help other older persons.
That's right.
So building those networks of support.
That's right, because I think you see with older persons who are able to empathize, all of a sudden we see that we can tap into that caring, and so the more that we can tap into people's caring and rekindle that within our communities, we think that's what we need to have in.
Well, that is that mutuality again that I hear you all talking about, right? That to be a teacher of caring and connection is to be a learner about caring and connection, is to be a teacher. So another one of the cycles, Adriana was reminding us of the cycles, the paths that we run. I'm going to move, if it's all right, Amy, to Michelle. And in your early days as well, where you probably have a lot of choices, as others have said, about what you're investing in as you build out a network. How do you set that framework and make those choices?
Lisa, I think that's a very good question. I think first of all, we need to acknowledge that social needs are very complex.
They are.
Again, you are saying, so one size does not fit all. I mean, maybe we could get to one size fits most, but I think we first need to acknowledge our social needs are complex. They change over the life course. Encouraging people to say, I don't know, join a knitting group. Might not be a cup of tea for everyone, so that might be something, it's like, well, maybe not, but I would prefer X, and actually ask the person. And this is why that diversity of voices and always consulting the end user of what kind of programs is really important, because without actually designing effective solutions that stem in evidence and without integrating the consumer voices, you
Yes.
might develop a really awesome program, but really the uptake or the retention rate is very poor. So I
Yes.
think asking people, co-designing programs, getting the voices of older people, younger people, whatever group you're targeting, it's so vital. And
Yeah.
I would imagine, for example, some of the at-risk populations in Australia, people with from low socioeconomic backgrounds, single parents, for example.
Yes. Marginalized populations.
Exactly. The way they engage in these sorts of programs are very different.
Yes.
And I would also speak to people with serious mental illness. If I were to say, go and join a group, but they are actually joining in a group in which they may face further discrimination or might feel more stigmatized because they feel different, perhaps then that's not the right time. So we need to consider solutions that are specific to people's context, preferences, and also this low intensity to high intensity.
Yes.
There are a lot of people who experience transient levels of loneliness and may not actually need, I guess, the full works of something that's very comprehensive.
Yeah, I think you're right, Michelle. And it's that, again, you're talking about duration and dosage, right? So that we understand whether or not we've really built the connection to the reliable network and or the critical supports. But I've been so appreciative that each of you has talked about, in essence, human-centered design. That it's so important wherever we are around the globe that we don't sit back and say, well, we've read the research reports or we funded them and we think X should be dropped down into this community or for these individuals. So just know how grateful I am that that we all understand the importance of the voices and the lived experience of individuals and the complex interrelated social determinant needs that have to be addressed with a variety of solutions. I want to talk a little bit more, Paul, have you jump in on social prescribing. I find it really interesting. It's being, talked about and thought about around the world. Among the things I find interesting about it is this recognition that social isolation and loneliness have such negative outcomes, and that the medicine is connection. So if you might talk a little bit more, I think Adriani, you really spoke about that as well. How is that going? And then anyone else, if you jump in around, we've got to talk about digital. What role does digital play? So Paul, the social prescribing.
Yeah, social prescribing is it's not our idea, it's an idea.
Yes.
That is the centerpiece of the government's loneliness strategy. Now, for it to work, it depends on a number of different things. It depends on people who are helping in the health center to
Yes.
have the skills and the knowledge of what's going on, and that very acute bit of psychology about how do you help people move out who have become very there are a lot of things there which we need before social prescribing can really work to empower people and direct them. And I think there are two issues, one of which you've just mentioned, which are all about access then, because it's no good health center and pulling out a sheet of stuff that is available if the person can't get there.
Yes.
And that is a huge issue for all of us, that of transport. But the other big issue is digital access. And I think that COVID, as I said before, has widened that gap. And we've got to do better than we're doing at the moment to try and close that gap and make more people able to get on to and comfortable with accessing things digitally. That calls for a lot of coalition, a lot of working together, sustained drive.
Yes, because you're right, Paul. That's really about public policy. That's about resources and how we use budgets as real statements of values about who will support and who we won't. But as it relates to the social prescribing, I think you're right, Paul, too. Many of you have talked about, you need to identify the need, but it's more than a warm handoff. You have to really be sure. And Adriani, maybe you'll jump in here, because in the work you're doing, you're seeing a need, but you have to be sure that an agency is available and ready to pick up the work.
Yes. Yes, and that's hard. In
Hard.
Brazil, yeah, we have wonderful laws. We have a wonderful health solution for poor people, but it's basically in paper because it doesn't work. And doctors have 5 minutes conversations with their patients, and it lacks everything. They come out of this appointments with these doctors with more doubts than they were before. So when they are referred to Saúde de Criança, we need to understand all the living conditions, everything that is surrounding these families, all the challenges, and it's very interesting that you said about it's centered on them, and this is the essence of what we do. So each the families stay 2 years with us, but each one of them has different actions and a different plan from the other, and this is very important. So it really goes to their needs, right?
Yes.
And we were talking about access also, and not having this is, for me, this is definition of social isolation. It's not being part of the society.
That's
it's
right.
Not
That's right.
to anything. It's not knowing where to go to even take a birth certificate for your son. It's not having money to pay a painkiller for a child that's suffering. So
Yeah.
this is really social isolation. And each one of these families, as they are in extreme poverty, they're very vulnerable. Each one of them needs a different solutions, and that's
Yes.
why we need a very big network, and it's the only way
I appreciate that so much. I think that, I leave this panel, and it's time to wrap up, and to thank all of you for the work that you're doing and your leadership. I am more convinced than ever that staying connected globally is very, very important as we share data, solutions, frameworks, as you've all said, and our learnings, that we continue to build a global learning community, because we are in this together. So I know that all participants join me in thanking you for your leadership and the smart, committed, compassionate, empathetic approaches that you're taking to this work. Thanks for all you do.
Thank you.
Great to be with you. Thank you.
Thank you.
Great. Well, thank you, Lisa, for your expert panel direction, truly. And thank you for each of our international partners for making the time to share with us today, especially to our partners in the UK and Germany at such an incredibly late hour. Thank you both. The Coalition is thrilled to partner with the AARP Foundation and with each of these nations to learn from their expertise and share our own. And we're excited to grow our ranks in this global collaborative for even greater and global impact. For our next and closing keynote address, we have the honor of receiving an audience with not one, but two members of Congress, Congressman David Trone of Maryland and Senator Tina Smith of Minnesota, to speak about their leadership on these issues in Congress and what their vision is for the future. First, we have first we'll hear from Congressman David Trone. He was elected in 2018. The Congressman has the honor of serving Maryland's 6th congressional district. As a member of the House of Representatives, he serves on the Education and Labor, Foreign Affairs, and Joint Economic Committees, where he's fighting to make progress on issues that matter to Marylanders, including the opioid epidemic, criminal justice, and funding for mental health research. Representative Trone is a key leader and congressional champion of policies addressing the mental health space. Most notable for today, he has been a critical champion within the House of Representatives for policies and solutions that address the crisis of social isolation and loneliness. His efforts to authorize the Older Americans Act and introducing additional legislation to address social connection now during the COVID-19 pandemic make him one of the coalition's leading congressional champions. Aside from his focus on older Americans, Representative Trone continues to advocate for policies that would improve funding for mental health research, as well as broadband expansion to increase awareness and decrease the impacts of social isolation and loneliness. We'll then hear remarks from Senator Tina Smith, directly following Congressman Trone's remarks. Senator Smith has represented the great state of Minnesota since 2018 and serves on the esteemed Senate Health, Education, and Labor Pensions Committee, the Banking and Housing and Urban Affairs Committee, the Agricultural, Nutrition, and Forestry Committee, And in only her 2 years, in only the last 2 years, excuse me, the center has made a significant impact on numerous high-profile topics, including prescription drugs, rural health, and economic growth. Since beginning her tenure in Congress, the center has pioneered solutions to address social isolation and loneliness, similar to Congressman Trone, and including reauthorization of the Older Americans Act and additional legislation that we've talked about. I'm going to turn it over to Congressman Trone. Thank you so much for joining us, and we're looking forward to hear from you.
Okay, good evening. Hi, I'm Congressman David Trone, Maryland's 6th District. I'd like to thank the Coalition to End Social Isolation and Loneliness for inviting me to speak here today to discuss this important issue. Although we couldn't come together in March, it's great to do this virtually today. This forum couldn't be more important as millions of people are struggling with isolation from COVID-19 pandemic. More than 8 million Americans already experience social isolationism. Nearly half of our older adults felt isolated, alone, left out prior to this pandemic. And these numbers have only gotten worse over the past several months. The numbers on mental health are alarming as well. Calls to disaster distress hotline are up almost 900%. Over half U.S. adults said in a recent poll that worry or stress from COVID has led to at least one negative effect in their mental health and well-being. These are issues that demand immediate action, and we can help address them by creating greater connections and opportunities for human interaction. During my first months in Congress before COVID, I held a seniors workshop in my district. One thing was clear: social isolation was a huge concern then. After hearing this, I made tackling that issue a priority. Last year, I introduced the bipartisan Protecting Older Americans from Social Isolation Act of 2019. Republican Congressman Tim Walberg joined me. This legislation amended the Older Americans Act of 1965 to address the growing negative effects of social isolation on mental and physical health. I'm proud to say this bill was signed into law earlier this year by the president. I've also been proud to partner with Senator Tina Smith throughout the COVID-19 pandemic to double down on our efforts to combat social isolationism. Our bill, the Strengthening Social Connections Act, will provide emergency supplemental funding, over $100 million, to programs that strengthen social connectiveness and address the negative health effects of social isolation on older in the Older Americans Act. I look forward to continuing to work with Senator Smith to get this bill to the president's desk. While we're going to find a vaccine for COVID, there will not be a vaccine for loneliness. We need to continue to work hard in a bipartisan way to make sure that all Americans feel safe and connected during this pandemic and far beyond. So thank you for all the work you're doing on social isolationism, loneliness. It's absolutely crucial to help our seniors who are really paying a horrible price before the pandemic, and that price has only quadrupled in the pain and the isolationism. And it's great to work with Senator Smith, who's up next. So thank you very much for all your work.
Hi, I'm Senator Tina Smith, and I want to first start by thanking my colleague in the House, Congressman David Trone. You are a leader in addressing the crisis of social isolation and loneliness, so it's an honor to work alongside you. And thanks to the Coalition to End Social Isolation and Loneliness for inviting me to participate in today's Action Forum. You are doing such great work to raise attention to this national crisis, and with your help, I'm working to do the same in the Senate. I start with the fundamental belief that everyone should have the opportunity to live happy, fulfilled lives. It's important to lift one another up out of isolation and loneliness. And we should encourage social connection because it is the morally right thing to do. So here's what we know from the data. More than 8 million older Americans lack social engagement. and socially isolated adults are at a greater risk of poor health. In fact, social isolation-related mortality rates are comparable with the risks of smoking, obesity, and air pollution. This also leads to economic consequences. Medicare spends $134 more each month on socially isolated older adults. This is comparable to what Medicare spends on chronic conditions. So COVID-19 has put this national crisis into full gear. Today, 30% of Americans feel lonely due to the pandemic, and more than 1 in 4 Americans face mental distress because of COVID-19. That's a 700% increase from where we were before the pandemic. So what should we do about this problem? Well, we need to identify what's working at the local level. Here's one example. In March of 2019, I visited the Wilder Foundation, a Minnesota organization that supports the well-being and independence of older adults. And there I met Maggie and her daughter Addie, who volunteered to deliver Meals on Wheels. Addie developed a friendship with Gertrude, one of the meal recipients. Gertrude didn't just benefit from home-delivered meals, she benefited from the human interaction with Addie. And Addie gained a new lifelong friend. So here's another example of what's working. When elders who were part of the Bois Forte Band of Chippewa voiced concern about feeling socially isolated and depressed, the tribe's behavioral health department paired them up with pen pals. And now there are more than 40 tribal elders who have pen pals with young community members and non-native volunteers. This is an innovative way to make new personal connections, to share knowledge, and to pass down traditions. We should be actively identifying, supporting, and strengthening programs like these to address social isolation and loneliness at the local level. And we should provide federal resources to scale these programs. My bill, the Older Americans Social Isolation and Loneliness Prevention Act, calls for increased awareness of the need for social connection amongst seniors within the Older Americans Act. It supports screening to identify who might benefit from more social interaction. It makes sure that the Assistant Secretary for Aging pays attention to this issue and engages with stakeholders to better address social isolation in our country. And it provides grant funding that can be used to help seniors connect with their community. So thanks to your help, these provisions were enacted as part of the bipartisan, bicameral reauthorization of the Older Americans Act earlier this year. But there's more work to be done. In the short term, we need to provide emergency funding for programs that strengthen social connectedness during the COVID-19 pandemic, including technology. Because even though we have to be physically distant right now, we can still be socially connected. And in the long term, we should be identifying opportunities to raise the profile of social isolation and loneliness at the national level. And this is why this Action Forum is so critical. You all play a crucial role in capturing this moment and raising awareness around social isolation and loneliness. And you can count on me to be your partner in the fight, because all Americans should have the opportunity to live happy, fulfilled, connected lives. So thank you for all that you're doing today and for all that you'll continue to do. And thanks again for this opportunity to be with you virtually today.
Great. Well, thank you, Congressman Trone and Senator Smith. You've been dedicated champions to this cause, and we're so grateful for your time and for joining us. I'm joined now by my co-director, Andrew MacPherson, and we're going to wrap up today's event.
Well, Eddie and everyone attending, I don't know about you, but I'm just overwhelmed and blown away by all that we've heard today. What an extraordinary afternoon that we spent together. I just keep thinking, going all the way back a few hours now to David Brooks's comments and his discussion with Meals on Wheels. Gosh, thinking about that notion of addressing loneliness has to be personal, Eddie. It has to be, to see each other deeply, we have to be deeply seen. I don't know about you, but I was really moved by those words, and I thought it just really, kicked off our day in just the perfect way. The Scientific Advisory Council, how lucky are we to work with them? These are the leading voices in the scientific community across the country and globally. We are going to learn so much from the interaction between these experts here in America, but also with the innovators that we'll hear from tomorrow, and really thinking about the interactions between those two communities. That's where we're going to really see the exciting work of the coalition and of the broader community focused on this issue, I think, going forward. I'm not even sure where to start with the international panel. I mean, it's just fantastic to see the common themes and the common issues that we're all focused on globally. You know, this idea kept coming up in the panel around creating a framework, and so many countries have already done so much work in this area. The UK, Brazil, Canada, we have so much to learn, Eddie, from each other. And I want to thank Lisa Ryerson in particular. She's just a master in ARP Foundation, has been such a leader for so many years in this area. So we're just very lucky to have her with us today. And finally, our congressional champions. Really the DNA of our organization here in Washington, in the United States, was really built around the idea of developing bipartisan and supporting bipartisan bicameral legislation. And that's what Congressman Trone and Senator Smith have been doing for over a year now. We've even seen, as Congressman Trone referenced, legislation written and signed into law via the Older Americans Act. What an extraordinary win for us as a broader community, not just the coalition, but a broader community in this country. So it's just really powerful, I think, to hear from both of them and think about you know, the fact that we've got such strong congressional champions going forward. I'm really excited. I'm fired up, Eddie. We've got a really exciting day, morning tomorrow as well that maybe we could go over together for just a moment.
That's great. I completely agree with you, Andrew. It was such an informative and inspiring day. And as you mentioned, we have so much more tomorrow to dive into. As you saw today, we really focused on the bigger picture from all levels. And tomorrow we'll be diving into the national and community-based organizations, really delivering these services and care across the country to build greater connection. And of course, you know, at the end of these 2 days, we'll culminate with our Commitments to Action panel from national and community-based organizations committing to taking root and action against social isolation and loneliness to foster greater connection. We're just so thrilled for what we've had today and what's to come tomorrow. I just want to mention to everyone, if anyone has any questions on what you heard today or in preparation for tomorrow, please reach out to us at info@socialisolation.org. And if you need any other support, please also reach out. We're looking forward to having you all join us tomorrow. Please share the links and the registration, and we'll see you tomorrow.
Thank you, everyone. Thank you. Have a great night.